Hello and welcome to Real Health Conversations. I'm your host, Leah Williamson, and I'm with my co-host, Holly Barrett. How are you, Holly?
Hi, Leah. I'm great. How are you today?
Good. It's good to have us back together. We've got a great guest today. We're welcoming Dr. Lucy Burns. Welcome, Lucy.
Oh, thanks, Leah. Thanks, and Holly. Thank you so much for having me. It's exciting
Great
to be here.
great to have you here. Dr. Lucy Burns is a GP and lifestyle medicine physician and has an online platform and a program called Real Life Medicine and a podcast called the Real Health and Weight Loss Podcast with her business partner, Dr. Mary Barson. And we're going to have a chat today a little bit about medical hypnosis, which is a very interesting topic. But before we do, I wanted to talk about your journey into low carb, Dr. Lucy, and what you're doing now, because you're doing so many amazing things. And I just wanted to say before we go into that, like, I've met Dr. Lucy in person. She is a lovely, vibrant person. So you will hear it in her voice if you're listening to the podcast, but I can vouch that she is in person as well. I love catching up with her at Low Carb Down Under, although we haven't had one since 2019. So one is coming up in October on the Gold Coast if you're in Australia, or you can get to Australia and get to the Gold Coast, October 14th to 16th. And we'll be catching up then again. So
I know. I can't wait. I'm super excited.
I know. I can't wait to give you a hug. I'm going to
hug
you. So let us know a little bit about your journey and how you got to where you are now.
Absolutely. So, look, I was working at a job. So I met a doctor. I was working at a job, actually working for Department of Defence, which I started after I'd had my children. And it was a really low-key job, close, kind of easy, but certainly didn't light my fire. And I interestingly had just sort of assumed I would stay there till I retired. It didn't, it was just humdrum. Anyway, a series of events conspired to the workplace becoming quite toxic and just certainly uncomfortable in a place I really couldn't stay. So I had to think of what else could I do, because I'd been at this place for 15 years, and it was one of those things that when you're changing a job that you've been at for a long time, it was a bit scary to go out into doing something else. So I was a tiny bit afraid. But in amongst all of this time, I went on holidays to Noosa, which if you're in Australia, you know is a beautiful, beautiful part of the world, with a friend of mine, a family that we always go away with. And she's another doctor, and she was just looking fantastic. And I go, oh my God, you're glowing. What's going on? And she said, oh, I've just dropped the carbs. And I'd sort of heard about lowish carb, but didn't really know anything about the science. And she starts, I say, so, and I'm sitting there eating a bag of carrot sticks, actually the heaviest I'd been, but, I didn't really know what to do. And she started telling me about it, and she sort of said, oh, you ditched the fruit. And I'm going, what? What sort of diet ditches fruit? I'm not doing that. And then over the course of the week that we were there, I saw what she was eating. I'm thinking, oh my God, this looks so good. I can't believe this. And I'd been a, chronic dieter my whole life. And the dieting was either perfect, calorie counting, point counting, low fat, scraping the butter off my bread, no, vinaigrette on my salad, just diet food, as I called it. I was either doing diet food or I was just on a bender, eating whatever I wanted until that, the next time came that I could get up the energy or the gumption to do another diet. So I initially approached this like my usual dieting history of a diet. Oh, well, I'll do this for a bit and see what happens. And, maybe I'll lose some weight. And anyway, it was like this complete light bulb happened, because I was eating, and finally I was doing a diet where I wasn't hungry. I was doing a diet where I was looking forward to the food. And I was doing a diet where my brain stopped chatting. And it was like this little miracle. And I thought, oh my God, I've got to go. And so then I decided to go down the rabbit hole and do a lot more investigation and all the stuff that lots of us have done, attended, multiple low carb conferences, suddenly became obsessed, read every book I could. And that's when I went back to my workplace and thought, oh, I know what I need to do. So I had a fire in my belly and I wanted to share it with everyone else. So I basically left defense and went into, back into private practice and set up what I thought was interestingly, I called it an epiphany and it was called Epiphany Medical Weight Loss, because I thought, oh, this is it. I found the magic bullet. This is it. But interestingly, over time, I've also recognized that there is way more to it than just knowing what to do. But for lots of people, it's unpacking a whole pile of psychology, a whole pile of stories in your head, and the actual knowing what to do and then implementing it can be quite two separate things. So that's it.
It's so true. I love that. We go through that journey and we discover the food first, because it's kind of like one of those easy things, like I can control, well, or I try to control what I'm putting in my mouth. And I can understand, I can read it and find out about it. But it is sometimes that separation between that mind set and the food that can be the hardest bridge to try and, build back together. So I think that's,
And look, we call it the physiology. So low carb addresses the physiology. So that includes, insulin resistance and the sugar highs and lows. And so low carb will fix that. But then we also have to address the psychology, which is that all or nothing, various forms of mindsets that people have. And often just long held beliefs around either food, body image, self-worth, all of those things. They're actually the biggest barriers, not the food.
Yeah, totally. And so much is learned from our families and passed through generation to generation. So yeah, making that break is such a one to overcome. So tell us about real life medicine and your programs and things like that.
Yeah. So after moving into private practice, it was fantastic. But I also realized that I can only see, seeing people one-to-one means that you can impact those people's lives, but no one else. Like you can't scale. So, and COVID came, of course, and suddenly the online world opened up. And and I met Mary at a low carb conference, so hooray. Mm-hmm. And we just had so much kind of alignment. And so we just said, why don't we, make a program online and see how we go. So we sort of winged it to begin with. And it's been fantastic. Like, I think, we call it this. So the sort of secret sauce that you need is content. So that's what the program does. You need community, because sometimes you feel like you're by yourself, that you're the only one who's, stuffing it up. And you need coaching to change those mindsets. So those three things have therefore made the program just so, like, we're so grateful for people that come and follow us or do our programs, because with the feedback that we've had has just been so beautiful. So for me, when I look back at the job I was doing, where I was just like a robot going to work because it was convenient, close and easy, to now this feedback, the passion, the excitement, it just lights me up. It's so bloody wonderful. And so, so we love that. So we do like a 12-week program, which we called the 12-week mind body rebalance. So again, the body rebalancing, and it's all about rebalancing your hormones and the physiology, and then mind, undoing all those years of diet culture that we've all been exposed to. The slave to the scales, the all or nothing mindset, the classic is the people that are starting a diet, so you eat everything in sight before you start the next day, all of that stuff, just helping people unpack that, undo it, relearn.
And one of the tools you use is medical hypnosis. Yep. And do you want to tell us just briefly about that?
Yeah, absolutely. And again, this was one of the amazing things when I think about synchronicity. So Mary and I had both done a medical hypnosis course with the same teacher at the same college, but at different times. And it was so weird. And interestingly, Mary's dad has done the course, and he's an anaesthetist. And he actually anaesthetized my daughter once before I knew Mary, before I knew anything. And as part of her induction, he used a hypnotic technique.
Oh,
just
wow.
go, oh, I know.
Small world.
Yeah, small world.
What's an anaesthetist? A what?
Anesthesiologist.
Oh, okay.
Yeah. So Australians call them anaesthetist, Americans anesthesiologist.
Okay. I was like, I don't know what that is. Got it.
Yeah. So So medical hypnosis, or hypnosis, hypnotherapy, it's a technique where the way our brain works in general is that we've got our frontal cortex and prefrontal cortex, and that's the logical brain, the thinking brain. And then deep, we've got our amygdala, our emotional brain, and our subconscious brain lives there too. It's where our memories are stored. And a lot of that we have no awareness of. So the frontal brain is all the awareness brain. And then deep in our subconscious is the unawareness that's there, but it's still there. It's working away. And for lots of us, we've actually been exposed to hypnosis without even realizing. So what happens with hypnosis is we need to get into a relaxed state where the frontal part, the conscious part of your brain, basically goes offline. And so it has little rest, and then the subconscious brain takes over. Now, interestingly, we do this quite often, and you'll see it with kids watching telly. It's called a trance, that relaxed state. But when you've seen kids watching telly and their just eyes are open, glued, and they're just there and they have no awareness of anything else that's going around. They're basically entering a hypnotic state, which is why advertising. Oh, sorry, my kids somebody's doing something out there. Why advertising is so incredibly powerful on television, because a lot of it is subconscious. So it goes in there, you don't even know it's there, you're so busy being this, and then bang. So we've had years and years and years of actually being hypnotized, if you like, through marketing messaging. And that's stuck in there. That's why there's so many parts of our brain that where we just, when people go, I don't know why I can't do it. They don't, because their frontal brain has got no idea. But their subconscious brain knows well and truly what's going on. So the idea with hypnosis is we get people into a relaxed state. So it has two benefits. One is the relaxation phase, which I'm sure you've talked about, where the idea of relaxation is activating your parasympathetic nervous system. It is incredibly powerful healing technique in itself. So the relaxation in itself is helpful. But then while you're in that state, as I said, your conscious brain goes offline and your subconscious brain starts absorbing it. And I often say to people, the feeling can be like, if you've ever had that thing where you're asleep on the couch, maybe on a Saturday afternoon, you've got your family all around, but you're just having a little rest on the couch, and you've kind of got awareness that there's stuff going on, but you don't care about it. You're not interested. You're just having a lovely rest. You're not actually asleep, but you're having a lovely rest. And you knew that if the place caught on fire, you could wake up and get on with it. That's actually a hypnotic trance. That's a hypnotic state. And it's beautiful. It's lovely and restful. You don't want to come out of it, because you go, oh. And so while people are in there, we will then talk to their subconscious brain and basically put in some really helpful and often very powerful, they're called suggestions, hypnotic suggestions, to particularly rewire. So that's kind of the summary of it.
So the next time my husband's dozing off on the couch, I'm just going to be like, do the dishes.
Absolutely. And if his conscious brain is off, he's
gonna wake up and be like, what? Huh?
Yeah. I'll go, gee, I've just got this hankering to do the dishes.
So what is the difference then between medical hypnosis and just like regular hypnosis? Like, I've been to the fair and they have people on the stage and they're making their shoes ring and think like it's a phone. So what's the difference?
Yeah, so I guess for us, it's we're not using hypnosis for entertainment. It's really for medical purposes. So the purposes can be they can be psychological or even physical. I mean, our mind and body, they're one unit. It is sort of interesting, isn't it, that we separate the mind out like it's not part of us. But obviously it is. The brain is so complex, so powerful, and you can use the brain to tell the body what to do. So, we can use our hypnosis. We can, pop suggestions in there that, you will, as an example, let's say, if you find going to work stressful for whatever reason, we could do a hypnosis that will allow your muscles to relax as you enter the door of your workplace. And so using those sort of techniques in a way that is related, I guess, to your health, your physiology, your psychology, is really what medical hypnosis is. And I guess for us, it is taught. We were taught by a doctor. So we're not, and I always say to people, you know, you're not going to be quacking. We're not doing any of that.
It has
stuff.
a purpose. It's not party tricks.
Yes.
Okay, so I think a lot of people have some blurry lines here when you think about hypnosis, especially when it comes to like treating certain ailments or working with psychological issues. Or you can also use hypnosis for like mindset changes. So what's the difference between medical hypnosis and maybe doing like meditation and affirmations?
Yeah. Great question. So there is a bit of an overlap. So the way I think about meditation, so meditation is the process where you know, and again, meditation's a whole big topic because there's lots of types of meditation, but most people these days are relating meditation to mindfulness. So in mindfulness, what you're doing is you're bringing your brain back to the present. So your brain likes to wander off and think about, you know, shopping lists, how many piles of washing there are to do, all of the things that it chats and it commentates on you. And what you're doing in meditation is you keep bringing it back to an anchor. And that anchor might be your breath, or it might be, you know, the lights behind your eyes, or it might be a vision. It might be a mantra. So that's what you're constantly doing. You keep bringing it back, keep bringing it back. So in fact, you're actually being quite conscious. So it's almost the opposite of hypnosis. Both of them have the ability to bring you into a relaxed state. So there is some crossover in the relaxation part of it, although lots of people will tell you, and you guys probably know this, when you first start meditating, it feels like the opposite of relaxation because your brain just wants to run off and do whatever, and it's frustrating and you get yourself all tense. And so it's like, no, don't worry about that. So that whereas hypnosis, we go relaxation, very relaxed, getting your brain deeper and deeper. The tone in which you use is really important because people just, you know, when they become essentially mesmerized by your voice. And the biggest thing I think is that people need to trust you because otherwise you won't let go. So again, it's that thing of being really mindful of your location. Like you can doing hypnosis in the car is good, not while you're driving, but parked in the car, because again, you're in your sort of safety zone. You know, I wouldn't recommend people go to say like the beach and maybe do a hypnosis because you'll often feel a little insecure. You'll be sort of wondering who's coming along. Am I safe? Am I going to be doing this? And so getting therefore into that relaxed state is much harder. And people will also often ask me, how many times do I have to do it? And it's interesting because there are people out there that will say you only have to do it once and you'll never smoke again. And actually, I think that's a bit of BS because if that was true, then advertising would only do one ad and that'd be it. But they do repetitive. And it's the same really with hypnosis. The more you do it, the better you will get into a hypnotic state more easily. And then the messaging will just continue.
That makes sense because the whole like what they say in marketing and advertising is someone needs to be exposed to your messaging at least 7 times before it sinks in. So yeah, a one-time deal wouldn't make sense from that rationale. There's this article here. It's called Using Hypnosis to Manage Physical Ailments. It's from Psychology Today, and it's about how hypnosis can be an effective clinical tool for the relief of physical symptoms. And it says patients with significant physical discomforts, they develop psychological issues because of their symptoms. And psychological issues, like if someone hears that, it might not really connect, but it uses these examples like a patient with asthma might develop anxiety because he is afraid of being unable to breathe, or a patient with IBS might be afraid of traveling because they would not have easy access to a restroom. And so I think those types of examples are things people could really relate to. But this one, like kind of really hit me. I'm going to read it for our listeners, but it's a 14-year-old with vocal cord dysfunction developed difficulty breathing because her vocal cord spasmed and nearly closed when she inhaled. She was treated with medications for asthma, allergies, acid reflux from the stomach, and when she didn't respond to those, she underwent a tonsillectomy, and then she didn't get better after that. So then it was recommended that she get injections of Botox into her vocal cords, and then finally her symptoms resolved after one session of hypnosis, hypnotherapy, and where she was taught how to calm herself and to prompt that relaxation of her vocal cords. And it's saying, like, had she been taught this earlier, they could have avoided like all these additional interventions. And so as a parent, to me, this just really struck me, because at what point, like when or how would someone look to turn to medical hypnosis instead of going down that path of all these medical interventions? Like,
Yeah.
should hypnosis be first, or like where does it fit in the diagnostic and treatment realm?
Okay, so that's a great question. And I think the way I approach, so I guess there's two ways I can approach hypnosis. So we can do I'm really sorry, is this noise? Is it too noisy? No, you're okay. All right, good. I can hear my daughter suddenly making smoothies. So so the way I approach it, so there's two ways. So you've got your sort of general hypnosis that, is helpful. So, we have our 31-day hypnosis for weight loss program. So that gives really generalized hypnosis, which are going to be, because a lot of the stories around weight management are the same. Lots of people say to me, oh my God, you're in my head. And I go, I know, because everyone's got the same story. So we can do that. The second arm that we can do is individualized hypnosis. And that's really what you're talking about there. And it's really taking a really thorough history and an examination to have a look and go, all right, what's the root cause here? Now, it's interesting because sometimes people aren't ready to hear that the root cause might be related to what their brain is worried about. And so again, people can feel dismissed because they'll say, and they'll come back and they'll go, oh, the doctor just said it's all in my head. And so that's really disempowering. And it's really about the way of communicating the message. Interestingly, chronic pain, a similar sort of thing. So with chronic pain, you've got a pain receptor. It sends a message up to your brain. Something is damaging here. You need to move your arm, for example, if you've got your hand on the hot stove. So pain is meant to be an acute reaction. What happens when it's a bit like everything, what happens when it's ongoing is we get resistance. So just like insulin resistance, just like leptin resistance, our brain doesn't hear the signaling anymore. So we just get signaling coming up. The brain's can't interpret it in the way it's meant to. And so we end up with this cycle. And so saying to somebody, the pains, they go away and they go, the doctor doesn't believe me. The pain's all in my head. And it's like, no, the pain's real, but your brain is interpreting the cause of the pain and amplifying it more than it is. And so, but you have to be really, really clear for the patient on what you're trying to achieve here. So, because if they feel dismissed, nothing's going to work, as we know. Nobody wants to feel unheard. It's awful.
I love that. For people also who, there's a lot of fear around people with allergies and anaphylaxis or even autoimmune conditions. I've worked with a lot of people that are afraid of certain foods and things like that. And so then they become afraid of everything, the world they're living in. So something like this on top of working with them with what they need, I guess, like with food and lifestyle and everything like that, and then adding the hypnosis on top of that could be really quite powerful for a lot of these people.
Oh, absolutely. And, we have a line that we will use a lot, which is, and again, it doesn't work when it's in your conscious brain. You go, what are you talking about? But it is that idea that whenever, the line goes something along the lines of, whenever you feel worried or upset, you will take 1 or 2 deep breaths and your mind will say the word calm. And as a conscious suggestion, you go, oh, that sounds good, but you forget about it because it's not there. Whereas if it's buried into your subconscious and you've heard it a number of times, you'll find that automatically, you don't have to do it because it's subconscious. automatically you're taking a few deep breaths and calm just comes across you and you suddenly go, oh my God, I feel better. So, there's lots of little tricks, I guess, in there that we do.
Yeah, I love that. So let's talk specifically for weight loss now. So on your Real Life Medicine website, you've got, it's 21 day
31.
30,
It's a
sorry,
month.
31
Yeah,
days.
month.
A month.
Yeah, it's a
31 day medical hypnosis specifically for weight loss, isn't it?
Yeah.
So
yeah.
do you want to talk to us a little bit about that?
Yeah, absolutely. So it's a program that, has both Dr. Mary and myself, and we have different voices, obviously. Mary's is much deeper than mine, and I find it beautifully soothing. And there's a range, because again, it's like lots of things, and there's no one size fits all. So basically we have different techniques. So a lot of it can use imagery. And this is another interesting point to make, is that there's about 2% of people in the world who can't visualize. So when you ask them to close their eyes and think of a forest, most of us can go, oh yeah, and you can imagine a book and you can imagine all of this. Some people can't, like they just can't. And so we also talk to them and say, you know what, if you can't, don't worry. Just listen to the voice, just listen to the words, listen to the cadence. Doesn't matter if you can't actually imagine it. The imagery is purely there as like an analogy, if you like. And, I love analogies. So they're really, really helpful, again, for our brain to be able to go, oh, okay, I hear what you're saying. So, it's like one of my favorite ones is it's an analogy about a rowboat. And the rowboat is, you get all relaxed. It's all beautiful. You go down, you're on a path, a beach, whatever. And whatever, how some people have like nemesis food, their kryptonite, their thing that that it's like bad boyfriend. It promises the world, delivers nothing. And they want to get rid of it. So, but they're just something stuck. So we just get them to put it into the boat. And then the boat toddles off and it goes to someone else's harbour. And suddenly it's their problem. So then when they see that person, another person eating that particular food, they don't have FOMO. They don't wish they had it. They're suddenly going, oh my God, they've got my problem. Hooray. And so it just, again, is it just another beautiful way to be able to reframe what you think about, food or whatever. So yeah, whole different range of them. There's one about, feelings, like we call it the forest of uncomfortable feelings, because again, people's, why do we eat? It's rarely because we're hungry. It's for all the other reasons. So just, again, helping people come to, as a tool, one of our tools to help manage emotions. So yeah, it's, I think that they're all, again, the more you do, the better it is.
Yeah.
Does it work while you're sleeping, or do you have to be awake?
No, hypnosis is really clever. It particularly in that that going to sleep phase. That's actually, again, you go through a hypnotic trance in there. So during that phase, it will all come in. If you're in really, really deep sleep, then you probably won't hear it. But the hypnosis are all reasonably short, because again, we know people are busy. People they don't want to sit there and listen to an hour. I haven't got time for that. But they're between 5 and 10 minutes. And the key is really allowing yourself to relax and persisting, because at the start, your brain will want to wander off a bit like it does with meditation when you first start. So persisting and just really getting into that beautiful, deep, relaxed state.
Oh, it's lovely. I'm feeling that way already, hearing your voice. Is there anybody?
I don't think I'd be able to hypnotize anybody with my voice.
Yes, you would. You would. You totally would.
Is there anyone that you would advise or caution against, or anything that you would caution around hypnosis or using medical hypnosis?
Yeah. So obviously, as we mentioned, you certainly wouldn't do it if you're driving. It's really meant to be, you really, it's, don't do anything else while you're doing it. I know we do have people who will listen to them while they're ironing or whatever. And I guess you can, but it's not actually the purpose of it. The purpose is really to set aside some time in a place where you feel completely safe, and just allow yourself that relaxation. if I get, and again, that thing that we would, for group programs, pre-recorded programs, it's really about, they're very general. If people are wanting specific, more tailored, then, you have a consultation, and the script, if you like, comes from people's own words. So if I was say, I will do hypnosis for smoking cessation. Now you can go and do a pre-recorded one, that's fine. It's not going to be as powerful as having a discussion with somebody first to think about what are your blocks, what are the times that are difficult for you, what are your associations, and getting very clear on that, and then tailoring it specifically for those.
Yeah, that definitely makes sense. And then I think I had another article there, and it was talking about medical hypnosis for weight loss. But I think it was mentioning somewhere in there about the considerations and risks that maybe, possibly wouldn't be good for someone that's already kind of had a psychosis or something like that. So just, it might be triggering to some people. Have you ever come across anything like that?
Yeah, there is there's a phrase called abreaction. Which I actually don't like that phrase, because it sort of sounds like abnormal reaction. It's not an abnormal reaction. It's just just a reaction. So sometimes people get teary or cry or basically get an emotional release that then they don't know what to do with. It's quite normal. So again, you think about, there's often our emotions are bottled up tight, held in, and suddenly you provide a space for them to be released. So I often say to people, if that happens, don't worry about it. It's quite normal. It's, it feels uncomfortable, and you suddenly wake up and you're crying. You think, oh my God, what's going on here? But it's normal. So yeah, so I think just having expectations around what could happen is important. As far as psychosis, again, unlikely, particularly in a very generalized program. If you were doing very, very specific one-on-one, then more likely. But again, tailored is the key there.
Yeah, definitely. So, doing it in a safe place where you know that you're not going to be interrupted or feel uncomfortable, and setting the scene right first, and then if you're doing it yourself, and then if you're doing it with somebody else, obviously going to someone that you feel a rapport with, and feeling like you feel like you can trust them, kind of thing. You feel safe in their space, kind of thing.
Yeah, absolutely. Yeah. And I think one of the interesting things that I've seen in the weight loss sphere is somebody developed a program called the virtual lap band. And it's, again, I don't know the people, but physiologically, it's basically calorie restriction. It's the same. So basically they tell people just to eat less and move more. And so many people have come and gone, I've done hypnosis, and then they've come and talked to me about what they did. And it was the virtual lap band, which then encouraged them to eat 6 more meals a day. And then they wondered why they didn't lose anything. It's not their fault. They would, again, your hypnosis has to be helpful with physiology as well as psychology. They need to marry together.
Yeah, that's a great tip there. So I love your program. I've been listening to it. You and Dr. Mary have such beautiful, calming voices, and it's such a lovely thing. And I feel like I did do it in the car, but I'm outside my workplace just before I go in, and I lock the doors, and then I sit there and I have the sunlight shining on me, and it was just a nice warm spot to do it, because I have this gap between dropping the kids to school and starting work. So I was like, this is a good time to do that. And I didn't do it because I work in a yoga studio. I didn't do it in the studio, because if I'm in the studio, then people will want to come in already and set up. So I'm like, all right, this is my space in the car here. And it just feels nice and nourishing and warming, and then I go out and I start the day, and I feel like, I'm feeling good.
Yeah. And that, that's the perfect time. So, because you've described 2 things, you've done a habit stack. So you're already doing something. So you're just adding that habit in, and it's a transition phase as well, so that you can enter work with a really beautiful, clear mindset, not bringing the morning chaos with you.
Yeah, exactly. Oh, well, I love it. It's been great chatting to you about this topic. It's such an interesting, fascinating topic. Holly, do you have any other questions for Dr. Lucy?
No, you're right. It was very interesting and fascinating. I'm intrigued.
Yay.
Well, let our listeners know where they can find you and where they can find out more about the medical hypnosis.
Yeah, so our website is RL Medicine. So Real Life Medicine is our business name, and our website is rlmedicine.com. We're on all the socials under Real Life Medicine. And I'll send you a link. We're actually developing a little, just a free hypnosis for people. So like a taster so people can try. So I'll send you a link for that so they can download it and have a go.
Awesome. We'll put that into our show notes. And thanks so much, Dr. Lucy Burns, for coming on the podcast and talking about medical hypnosis with us.
Oh, well, thank you so much for having me, because it's just been amazing. Thank you.
Thank you. Well, that's the end of today's episode. Our theme music is created by Andrew Bowden, and production services are by Kevin Kennedy Spain of Disc of Light Media. Have a great week, everyone.